Welcome, my beautiful friend. This is the Time to Care the Caregivers podcast. I'm Isabel Melgarejo, your host. And I know we're all struggling with Medicare right now. We don't know what's happening, what's coming next, what should we be worried about. So, Kandice Hall is going to answer all of my questions, which I hope are all of your questions as well. Welcome.
Thank you so much for having me. I really appreciate it.
I'm so excited to have you and learn more about Medicare because I know, like, even big news, it's all over the place. So, why don't you tell us a little bit more about you and what motivated you to start this journey?
Okay, sure. So I am a mom of two boys. They're now adults now, a 22 and a 20, almost 20-year-old. And so when I was younger, they were younger, obviously, and I was in a healthcare field where I was in on call a lot in the hospital, and my schedule was pretty much according to their schedule. I didn't have my own schedule. And when you have kids and they're younger, you want to be a part of what they're doing. So I made the transition from doing somebody else's schedule to my own schedule. And so I transitioned into insurance. And then at that point, it gave me the flexibility in my schedule to help people through their healthcare journey. So whether that was looking at plans, trying to help groups with products, just trying to educate people. And then I found a need where people that are older that are getting on Medicare, it's just so confusing and there's so many choices. And so my whole thing is education and making it simple. So I just wanted to make it super simple, get the facts that they needed so they avoid long-term penalties and long-term things in the long run. So that's kind of what happened in my journey. So I enjoy helping people, guiding them, educating them, and just being a great resource for people.
You're like always so kind and so like well-centered and okay. For everybody out there, we were trying to do a Facebook Live, and I'm taking full responsibility that it didn't happen. And Candice was like, don't worry, we can do this another time. So that's
Right.
the type of
Just gonna
person
shift.
Candice is. Yeah.
Right. Technology is not always our friend, so we just got to kind of go
No.
with the flow.
Yes, we do. So, what are some of the things that people have more questions about? What is like the top three things that everybody asks and they should know?
Okay, so the most important thing that people should know is that there is a cost associated with Medicare. So people always think, oh, I'm getting into Medicare, it's going to be free. Well, there is a cost associated with it. So that's one of those things that people don't think about. And then there's also late enrollment penalties if you miss your deadlines. And those late enrollment penalties can be the entirety of when you're on Medicare. So when you get on, if you're 65, you're going to have them the entire time you're on Medicare. So that's another thing that people aren't aware of. They're like, I didn't know I had to do this when I first got on, or I didn't know that this penalty was going to happen. So, and then another thing is people get the misconception that they have to do it at 65. And there's some circumstances where they don't necessarily have to get onto Medicare when they turn 65. So if they're working and they are under a group health plan, they can delay their Medicare enrollment also. So I would say those are the top three because everybody comes to me with questions and they're all so confused and they're like, how do I do this?
So, okay, you're about to turn 65 and or your parents are turning 65. How do you start navigating the system?
So what I do is I tell people it's a process. I kind of break it down to a 3-step process. And so the first step is getting their Medicare card. And so setting up a Social Security account online and doing their Medicare enrollment for their A and their B if they're at that point. The next step is getting their information. So when we look at plans, we want to make sure their doctors are going to take the plan and that their prescriptions are going to be covered. And then, so it gives them the most savings. And then once we go through that process, I answer all their questions, then I can help them with enrollment. So I kind of break it down so they kind of know like what is supposed to be next and kind of where they're going to be heading. And then I'm their agent. And so they can count on me throughout the year for questions. I can help them with, things with the carriers, help them with questions about their enrollment and all kinds of stuff like that.
So, when is the perfect time to grab the phone and call you?
So people that are turning 65, they have a 7-month window before they have to do anything with Medicare if they're going to do it right at 65. So what I tell them, it's 3 months before they turn 65, the month of, and 3 months after. So that is their initial enrollment period where they can get enrolled into A and B. So some people, what they'll do is they're on a group plan, they'll just pick up Part A because a majority of people pay a $0 cost for that. And they'll delay their Part B, which is going to be their medical part that has a premium. And if they're on a medical plan through their employer, they can delay that Part B step. And then a special window opens up when they retire or they drop their health insurance plan where they can pick up Part B and go ahead and pick up their prescription plan and any other additional coverage that they need after that.
And with all of these changes that we're listening, like, can you like throw some light on us? Because for me at least, it's very confusing. And we hear so many different sides of the situation. And how are these changes in policy are going to affect Medicare?
So that is a great question. And a lot of it is kind of unknown at this point, because the new administration, most of the changes that come into play, even though they're talked about now, they usually don't come into play for another year or two. So as far as the landscape goes, I mean, we're trying to get more transparency on prescriptions. I know the current administration is trying to do that with lowering the cost of about 10 to 15 of the name brand prescriptions out there that are used quite a bit. And these, they're trying to get it to where it's more affordable for the people that are on limited income. Usually when you get on Medicare, you're pretty much on Social Security benefits because you're not working. Or if you are working, your income might be just a little bit more limited than what it was when you were in the workforce. So those are some things to look at and consider. And then just the premiums change every year. So it's one of those things to have to monitor and kind of see what is going to happen.
Okay, so are there any other changes in Medicare besides medications being cheaper that you see are coming?
As far as I've seen some changes come down the line about needing some pre-authorizations for pain medications under Part B, so under original Medicare. What they're trying to do is they're kind of cut down on the fraud that's been going on. They're trying to cut a lot of that out of the system. And so they want to make sure that the pain management procedures are going to be medically necessary. So they're asking the doctors to give authorization and send over paperwork to make sure that's something that that patient needs. So I have noticed that's going to be something different because usually original Medicare doesn't require any kind of pre-authorizations. It's just been one of those things where it's a national coverage. And so if it's needed, then it's kind of just taken care of. And then if you're looking at Medicare Advantage plans, those always need like pre-authorizations and referrals from primary care doctors and stuff for services. So that's something that's coming out in January or next year. And it's going to be kind of something new, like I said, for original Medicare.
So mostly the changes are going to be around medications, is what I'm understanding. The
Correct.
premiums are going to stay sort of the same, and everything else is going to stay sort of the same.
Yeah, so the Medicare Part B premium is going up. So it's currently 185. It's going to 202.90 in 2026, and then the Part B deductible is currently 257. It's going up to 283. So there's going to be a slight increase in some cost. And then once that deductible's met, then it's an 80/20 plan. So Medicare pays 80%, and then the beneficiary is going to pay 20%.
Okay. So, how do you help clients plan for these expenses, or how do you guide them so they're always covered and they feel safe that they will receive the best healthcare available to them?
So what I do is I try to start with them when they turn 65 or when they get to the point of needing Medicare. We have that conversation like I mentioned before. And then I just kind of I give them the full picture. I say, well, you have two options pretty much. You have either you can stay on original Medicare with a Part D plan and a Medigap plan, or you can look at Medicare Advantage. And so those two options work very differently. With your Medigap and original Medicare plan, you pretty much pay your premium and it covers a lot of your cost. And then on the Medicare Advantage plan, it's network based. And so you don't pay very much usually per month, but you're paying as you go have services done. So that's really over like a bird's eye view of the two comparisons. But I tell people, would you rather pay each month and not pay very much when you go have services done, or the opposite? And whatever they're comfortable with is kind of what we go with. And then I say, okay, well, then if we're going to do it, if you're going to, whatever option you choose, we need to make sure, like I said, your doctors are going to be in the network if you're going to do Medicare Advantage and your prescriptions are covered well under either option because they have to have prescription coverage no matter what. And so once after I go through that process and make it pretty simple and easy to, easy to understand, then they're like, oh, this isn't as bad as we thought, mainly because they get like a huge book every year. It's called Medicare and Me. And it goes through all of the plans in the entire state and whatever state you're in and all the information. So it's just a whole lot of information for that, which is good because you can't just get one plan for one area because there's plans all throughout the state. Um, but it's a lot of information for people to comprehend and kind of navigate because you could say, "Oh, I want this plan," but it may not be offered where you're living. So, um, in doing that, people understand that what they're getting into and that they have somebody they can call. That's the main thing because people are like, we don't want to call 1-800 numbers. We don't want to have to be on hold for somebody. We can just call an agent or text or email an agent that's local or in the area that understands where I'm coming from and what we talked about. Then it gives them that peace of mind.
What are some things when choosing an agent? What are some things that they should consider and they should ask to know that they're with the right agent?
So I would say that there's a couple of things to look for. So if your agent is charging a consultation fee, then that's kind of a red flag because we're not allowed as agents or as brokers to charge for our services. Everybody asks, "How do you get paid?" And what I tell people is that whatever carrier you choose to enroll into, they pay a commission straight to me. That's kind of how that works. So if they're saying, it's a $250, $300 consultation service that I provide, then you might want to ask what am I paying for? Because if they're talking to you about Medicare and Medicare things, you shouldn't be paying to have a conversation with somebody and help them. So I would say that's a red flag. And then if they're not presenting you with all of the options or they're just looking one company, then that may be somebody that doesn't have their best interests. They may be just focusing on something that they're only contracted with. Being a broker, you have several contracts that you can hold, and that gives your clients a lot more options. So you're not limited to what you can share information with them about because you have to be contracted and appointed with carriers that you talk about. So I think those would be the top two things.
And what happens if you already did a bad decision? Is there a way to like go backwards, or how do you fix things? Because for me, it is pretty much like, hey, you did it right, or you did it wrong. And basically, you have to live with your decisions forever.
Right. Well, the great thing is there's enrollment periods each year. So if somebody's on Medicare Advantage, the annual enrollment period runs October 15th through December 7th each year. And it just ended yesterday. But then they have a chance to make changes to Medicare Advantage. They have a chance to make changes to their Part D plan. and kind of everything that they need to do with their Medicare coverage can be in that period. If they do have a Medigap plan, they can kind of look at those options throughout the year. They're not tied to a certain enrollment period, which is nice because each plan or each year those plans have a rate increase of some sort. And so when people get their rate increase, they kind of look at maybe a different option so they can do that during that time. So you're not stuck. I tell people as like, well, if you just want to give it a try for a year and see how it works, see what you think, then, we'll just see and we touch base every year. I send out information to my clients saying the annual enrollment period's opening. If you need make any changes, you have any questions, something's going on with your health, definitely reach out to me and let me know. The other thing is people, they have that peace of mind knowing that I've helped them from the beginning, most of them. And so they know that they can count on me to guide them through whatever changes they may need to, have.
When is it a good time to connect with your agent or with you? Obviously, during enrollment, every enrollment period is like they need to connect with their agent. Is there any other times that it would be good to connect and get support?
Well, they can connect throughout the year. If they have an agent that they've got in their phone, another good way is when they're about to turn 65 or when they're about to retire or their group benefits are going to be no longer through their employer or if they're, not no longer working. So those are some good other options. A lot of people usually clients will refer me to their friends and family that are coming into age of Medicare because it's one of those things that people don't want to have to deal with. And it's just a lot that goes into it. So that's really the best time when they're turning 65, about to retire, or getting off their group plan outside of the
Okay,
enrollment periods.
perfect. And what are part of the reason why I was saying you kind of make your decisions and you have to live with them is because of fees or like stuff that happens. What are things that you need to do before, like to avoid those kinds of problems in the future?
So being aware that if you delay your Part B, because some people delay it because they just don't see a need to have it in place. Their Part B is their medical part of their Medicare. There's a late enrollment penalty for that. And so that's if you're not working and you've already missed your window to get into Medicare and you're currently not working but you're past 65, and they're lifetime penalties. So every 12 months that you don't have Part B, then there's a penalty that accrues for every year that you don't have it. So once you get it, it stops. And then you have that penalty that's accumulated for the entirety of you being on Medicare. The same with Part D, which is prescription coverage. So people may not have prescriptions. They're like, I don't take any. There are some plans that are affordable out there, but they think, oh, I'm going to have to pay a lot for a plan that I'm not going to use. I get a lot of that too. And that's also a penalty, but that's a monthly penalty. So it's 1% of the national average every month that you don't have Part D plan, in place after you've gotten onto Medicare. Yeah. So it can get a lot. I talked to a guy that was 90 the other day. He's never had a prescription plan. He always kind of used a discount or paid cash. So he was on like 3 or 4 medicines. So it wasn't, and at 8 to 90, that's really good to not be on a whole list of prescriptions. And so we sat down and kind of had a brief conversation. I was like, at this point, I think you just go with what you got, because there's no point in having him pay that penalty since 65 of not having a plan in place. So I do have people that are past 65 that are in their 70s and 80s, and they do run into that situation because they're like, nobody told me I had to have a Part D plan when I got on Medicare. And so, and those are lifetime penalties.
How
Another thing to
scary.
think about. Yeah, I know, because people are like, what? And there's another thing that people don't realize that with Medicare, so you have your base rate that I mentioned earlier, but if you are over a certain income threshold, then there's an additional amount that's added onto your premium. So it's called IRMA, and those income thresholds vary, and it's a 2-year look back, and it's a rotating 2-year look back. So usually people, and right now for 2025, it's 106,000 single and 212,000 filed married jointly filing. And so it's a 2-year look back. So usually people, when they get to Medicare, they're retiring, so their income usually goes down. They look back on a 2-year look back. And so if it's over that amount, then they add an additional amount onto the base premium. So sometimes I was talking to a financial advisor earlier today because she deals with people that are going to be retiring. And I told her, you need to help your clients that are going to be turning 65 or in the next, little while for that reason. You don't want them to pay extra once they've retired on top of that base premium. And she's like, I did not know that. So it's just those things. There's just different things out there that people don't know about until they become aware of it. And what happens is Social Security sends you a statement. You're like, you owe a little bit additional money. And they're like, what? So,
Why?
yeah.
Yeah,
So,
you were saying?
it's just one of those things that's put in place. For the people that have done well in their life, they kind of get a little upset about it because they're like, why do they almost see it as a penalty. So,
I can see that.
yeah.
I also see the part on let's get more and support more people so it becomes affordable for everybody. But
Right.
I can see that.
Right. So it's good to have other people kind of in your corner to refer people to. So, like estate planning people or having retirement people to partner with for that reason, to just get the information out, be a great resource for them.
Yes. Yeah, I think Medicare, and in general, I've lived in different countries, and healthcare in each country is so different. Like, even how you're treated by doctors and nurses is so completely different in every country. And just
Right.
trying to, like, each healthcare system is complex. I find
Right.
the American system like extremely complex. There are so many layers of things. Like you have your prescriptions and you have dental and vision on the side. And you have, so there are things that are just layers of complexity added into the healthcare system, which probably if you've always lived with that system, you grow up accustomed to how it is. But when you're new to something, it's like, what do I
Right.
need to do now? And then there are things like what you were saying, you don't know what you don't know, and you're like your Medicare, and all of a sudden it's like, oh, I'm 90 and I don't have a prescription, and I don't have the prescription part, so I guess I'm
Right.
not getting it.
Right. Right. And they're kind of at that situation, they're kind of like, well, what's worked is worked so far. So why should I change it? Or, I'm like, that's true. Yeah. Don't,
Yes,
don't
yes.
change, what's working. So,
You mentioned you have a YouTube channel. So where can people learn more about you, what you do, and how you can support people, and especially this topic that is so complex, at least for me?
right. Yeah, I do have a YouTube channel. It's got some videos on there, just some basic information. It's at klhbenefits.com. That's the website. And then I think the handle's like KLH Benefits. So that's where a lot of information is. And then you can also, find me online or through Facebook with the same tagline. So that way I share stuff on there about changes that are coming up through CMS or events that are local that could help my clients. So if they're doing like a seminar about how to save money on certain products or certain services, we have a great service in the Grayson County area, which is kind of where I'm at, which is Texas-Oklahoma border. It's called TCOG, and TCOG actually has, it's called Texoma Council on Aging. They offer services for Medicaid help and for Medicare and kind of programs that people would need help with also. So that's a great service for our area.
Yeah. So, is there anything you want to add to this conversation?
Well, I'm just thankful that you gave me the opportunity to talk to you and share information. And if anybody needs help, just has questions, I'm happy to just guide them, just answer their questions, even if they're not my client. Because if I don't know the answer, or if it's a service that maybe I don't provide, I can refer them. I have a lot of partners that I can refer them to for different services that they might need.
Well, thank you so much for coming and sharing all your knowledge with us.
Well, thank you. I appreciate being on, and thank you for having me.